eternity, so delivering a session after lunch is generally very tedious. I get that. So generally we do some fun activities, but I'm going to stay compliant to the guidelines here. There are plenty of seats here. Would you like to grab some? Okay. Thank you for choosing Pearl 1. I not for a second would believe that some of you had that sixth sense that I would be hosting this one and you chose this. But welcome back. Are we good to go? Are we good to go? Okay, got it. Sounds good. Okay, let's get started. Consumerism, continuous care, and care at home will be the future of healthcare delivery. At the core of this transformation will be focus on well-being and outcomes at affordable cost. The enablers for this transformation are advances like AI, wearables, IoT, 5G, and genomics. Pleased to invite Mr. Sureshkumar Rajasekar, PhD, Vice President Technology, Optum Global Solutions India, to talk about how these technologies intersect and define the future of care industry. May I please request you to put your hands together for Mr. Rajasekar.
Thank you. I hope you woke people up. Can we close the door? Good afternoon, everyone. I'm Suresh. I'm with the healthcare area for almost last 22 years. Post my PhD from IIT Delhi, I joined GE, 21 years there, last 1 year with Optum. I have dedicated almost all my career so far with healthcare area. I have worked across the globe with key opinion leaders in creating multiple solutions, including multiple devices which were created in India for the world, which were Harvard case studies as well as multiple IM case studies as well. Today, we will be talking about few areas that are emerging, which are less understood with a lot of misconceptions. And I'm sure that, we have a lot of entrepreneurs here, a lot of service providers, a lot of technologists here, and I'm sure there is something for each of you to carry forward to contribute in this area. So before getting on to the session, I would like to quickly intro UHG, which I'm part of. UHG is a Fortune 5 company. It made close to $290 billion in 2021, and it's steadily growing. One of the stocks which is actually going up, if you watch the NASSCOM, compared to the many stocks which are actually going down in the last 6 months. UHG, again, has two major verticals. One is the UHC, which is the United Healthcare, which is around insurance and benefits provider. And of course, Optum is kind of, I call it as a technology wing. It is IT-enabled health services provider for not only UHC, but also for other payers, which is actually competitor to UHC as well. Apart from enabling services for various providers in US, as well as for various state government solutions, including some parts in UK and other areas as well. So that's a quick intro about where I come from. Before getting on to the session, I would like to draw upon your attention on few tectonic shifts that has happened over the last 2 years. 5 years back, how many of you had a thermometer at home? No one? Thank you. Other than thermometer, did you have any other medical device at home to monitor your condition? Anybody here? One or two? Absolutely, right? Some might have probably had a device which was probably useful for BP monitoring in case you have some hypertension or other scenarios at home, or post-surgical care scenario at home. Some of you probably, would have had at-home monitoring your blood sugar as well. Beyond that, you wouldn't have heard parameters such as SpO2. How many of you have heard SpO2? oxygen saturation in blood before 5 years? Nobody, right? So like this, there are hundreds of parameters that gets monitored on a human body, which actually help in giving a better care, right? So the last 2 years, multiple things have changed. Multiple things have changed. Number one change is people are more aware and people are willing to share their data. People are willing to be proactive about healthcare. Earlier, it used to be episodic. I get into trouble and then visit a doctor. I just want to narrate a simple incident to talk about, like how we take care of our healthcare, right? So this was long back. One of the tier 2 cities in Tamil Nadu. I was just waiting for my appointment to the ENT specialist, and I heard this conversation. So the lady was with her daughter saying that, doctor, this problem is there for the last 1 week and the baby has been crying that her ear is paining. So what did you do for 1 week? 2 days I put some oil, coconut oil, and I thought some insects might have gone inside. So waited for a couple of days to see if things improve. Nothing happened. Third day, somebody told me, like I should put some haldi, just in case there is any infection, things should be sorted out. Then I realized that baby has, like the condition only deteriorated, so I came to you. So the doctor replied, if only you had added little bit masala, it would have become sambar. So that's how we take care of our healthcare. It is highly episodic, and many a times, believe me, many a times, I'm sure you would have heard that in your family, within your own close, near and dear friends, that by the time you reach the doctor, they would have said that it is already late. Simple conditions can actually worsen where you cannot recover 100% fully. So that's the status of healthcare typically across the world today, and these are all changing now. It has only accelerated post-pandemic. The other change that is happening is with the governments. 2 years back, I don't want to state any government for that matter, there were governments which were about to ban virtual healthcare platforms like telehealth and others. About to ban, almost about to ban before pandemic kicked in, right? Today, every government in the world realized that this is going to stay and this is most helpful, right? You need not wait for a pandemic to realize how critical virtual care could be, especially not only during, like situation like this, but also elsewhere, all other times as well, right? So this is another big change that is happening. One is with respect to individuals like you and me, increased awareness, willingness to share data, willingness to be more proactive about healthcare, government becoming more open to various technology solutions that are coming in, including telehealth and others, right? So these two changes are driving a couple of major areas to be focused upon, and I'm going to spend my time around those areas. Number one is consumerism. To appreciate consumerism, I would like to relate it to entertainment, right? Couple of decades back, if you want to entertain yourself, you need to go to a specific spot, a theater, a movie hall, and depending upon where you belong to or where you are positioned, the options are extremely limited, right? Today, the same entertainment is in your mobile phone, and you have access to the best in the world, irrespective of where you are located. This is the change consumerism can actually bring. Just to relate that to healthcare today, do you have access to the best of the doctors at the phone today? It is not there. So consumerism is going to lead us to a day where you will have access to the best of the doctors at your disposal when the need arises, number one. Number two, you have choices to make today on what you want to see, right? I studied in IIT Delhi. I just want to, slightly deviate a little bit. I was reminded that it's a post-lunch session, right? And when I was studying in IIT Delhi, if I have to watch my regional television, I need to wait till 11:30 till everybody go, and then only I get to see, right? So that was the kind of limited ways, right, where we had our entertainment at our disposal. Today it is, I can, when I was just traveling, I saw that not even a single individual, when I walk from the restroom in the flight, I saw that not even a single individual is watching the same program what other person is watching. The problem is very, very less. Everybody is looking for their own version, their own customized, their own choices. The same is true in healthcare as well, right? So this is what is going to drive consumerization. Next couple years, you will see that for similar ailment, you may not get the same drug as your neighbor. In the past, it is a normal story that all of us, for same symptoms, we all take same medications, right? Today, in cancer care and many other chronic disease management, this is already happening. It has been multiple times found that same sort of cancer onset does not require same set of treatment. It all depends upon the individual, the genomic pattern of that individual, and things can vary. It has been well proven in chronic disease management, and time is not far away that the same thing can be happening in regular acute care management as well. It is just a matter of cost and time, that's all. Now, getting into the next, we talked about how entertainment is not just limited to a particular location, it is continuously available. The same is true with healthcare. And I did talk about how things shifted big time post-pandemic, where people are more aware about their health and they are willing to be more proactive about it. This calls for continuous care. This is a major shift that is happening that most of us need to, be careful and monitoring it about, right? It is not about virtual care, which happens when I am in an episodic condition, when I am in trouble. It is about continuous care. 99% of the data that you are collecting, or your mobile phone is collecting, or your smartwatch is collecting today goes waste. It is not utilized well. It is not at all utilized. It does not go anywhere, right? Except for few providers who are realizing that it is not just about collecting data, it is also about making meaning out of the data, right? So that is happening in a few and far areas. It is a huge opportunity for many of you who are an entrepreneur in this location, to look at, right? So that is another major shift that is happening. Now, the third one is care at home. There is a misconception, especially in India, that and of course, Bollywood has only accelerated that misconception big time, right? It has only strengthened that view. There is a misconception that hospitals make money by making us stay longer there. It is false. The more longer you stay, they start losing money. The most expensive real estate in an hospital is an operation theater. And the next one is the ICU. And the next one is post-operative care units. And then, of course, general wards and so on and so forth. If your ICUs are full, do you think that hospitals will be able to conduct operations? You can't. Because immediately after an operation, after surgery, you do want to have a very close monitoring for at least 12 to 24 hours, depending upon what sort of surgery the individual went through, right? If all your ICUs are full, do you think that, the highest costing real estate infrastructure there is utilized well? It is completely underutilized, right? It's a misconception that most of us have. That is where some hospitals, including one in Delhi, 5 years back started offering this solution where for certain conditions, they are willing to provide a nurse at home along with certain patient monitors and other equipments depending upon the condition and the chronic condition that the person has to be monitored at home. It not only reduces cost, actually it avoids a lot of complications and including hospital-acquired infections. You might be knowing that, a recent report has been submitted about, true cause of J. Jayalalitha's death was hospital-acquired infection, one of the infections that typically happens when you are on a prolonged ventilator and so on and so forth. It's a rare occurrence, but it happens, right? These things are actually driving care at home big time. Not only the cost, but also the care delivery is much, much better. So we will start looking at in detail what are the benefits of each of those. Consumerism. I did talk about what are the key factors that are driving consumerism. The biggest factor that are driving consumerism is personalized medicine and individual care. These are the two benefits that is going to be the outcome of this entire consumerism. And of course, there are more and more evidence coming out due to pharmacogenomics where You study the genomic pattern of an individual and find out what treatment suits well, what sort of medication will suit well, and this is becoming a reality. And another area which we need to look at is, you are the best person who can actually, you are in a better position to help yourself. And today the doctors do not spend, how many of you appreciate doctors who spend more than 5 minutes with you in this place? How many of you really appreciate if doctors spend more than 5 minutes talking to you, understanding about what happened and so on and so forth? And when was the last time a doctor spent more than 5 minutes with you? Everybody is under tremendous pressure. Everybody is under tremendous pressure. What if the same doctor had all your information ahead before you meet him, highlighting some of the key points to him, so that within the time that is available, he is able to make meaningful conclusion about your condition and be able to make right decision. That's exactly what is going to be driven by consumerism moving forward. Everybody is under tremendous pressure. I go to like a normal consultation, my waiting time is 2 hours. 2 hours in typical cities, irrespective of Delhi, Mumbai, or Bangalore. That's how it is, right? And most of the time goes away, wailing there. What if all my conditions are already monitored, and with such a waiting time, when I enter in, the doctor kind of, just takes 1 minute, and I don't walk out satisfied. It has been found that 50% of the ailments can be sorted out psychologically as well. If only the doctor spent a little bit more time, actually, you feel much better, right? You feel much better. So there is tremendous pressure on the doctor. There is tremendous pressure on, on the patient, whether they got the right treatment for what they paid or not. And all these are going to change with consumerism. That's very, very important point to be noted, right? And a couple of things that are aiding consumerism in this area is, of course, your smartphones, your wearable devices, and availability of data, and of course, ways of ensuring that your data are more secure. So these are definitely things that are being taken care, and there is still a lot of opportunity to how do we proceed further. And the technologies, if you look at, number one, I have all the data. I did say that 99% of the data goes waste, right? Now, if only I'll summarize that in the last slide, how this all the technologies come together to solve these problems. But if only I have the entire population information, the number one thing that I need to do is, how do I stratify them to make sure that I target the right segment of population for same sort of issues, right? So you would have read the story how Dharavi, IAS officer, he managed COVID situation much better at Dharavi than how it was managed in many other cities recently, right? It's a very simple example how social determinants of health requires different treatment based on the segmentation. If you try to use the same brush across the board, you will not get the same outcome. It is extremely important you try to understand the segment of the population and try to ensure that your treatment plan, your monitoring methods, everything is changed. That's very, very important. And the other one I already talked about is pharmacogenomics. Basically, not only knowing the history of the patient, but also the genealogy of the patient, and try to see what will cater well to the individual. Very, very important. So what will be the major outcome of, or what will be the metric that we need to monitor to see whether consumerism is going in the right direction or not? Number one is outcome improvement, and number two is wellness. This is most important. It is not about episodic intervention, but it is about overall wellness even before something onsets. The second area is continuous care. And again, consumerism actually drives continuous care. And this is, again, if you look at the amount of wearables today in US, I think it is higher than, in terms of percentage of how much we have in India. And of course, the smartphone penetration also is a little bit higher in US. But considering the awareness that has happened and considering various schemes various state governments have done, the freebies that they have given, the penetration of wearables as well as smartphones have increased in our country as well. So this actually gives a huge opportunity for entrepreneurs and various service providers to see how we can leverage this ecosystem to provide continuous care. Very, very important, right? what are the areas where we can actually look at continuous care? Today, you look at systems that are around. Healthify Me, just to quote an application, right? It's a totally disparate application. Many of you might have. How many of you have a fitness application in your mobile phone? Almost all of you, right? You all have a fitness application. How many of you have a diet monitoring application on your phone? Sorry, these are a little bit personal information, but like nobody's going to watch who lifted their hand, okay? So if you look at the applications that you have, which helps on your, or aids in a better health, at least we will have, like 1 or 2 in our phones, right? Is the data collected by those applications being used by your physician? No. That is the gap that we need to solve. That is a gap that we need to solve. Imagine a situation that if you are a care provider, right? If you have access to what was the diet pattern and what was, like is there some sort of, like allergy situation that the individual went through? Did the patient starve, did not have right proteins? That could be the reason for tiredness versus spending 5,000, 10,000 rupees going through all kind of blood tests to find out nothing, everything is normal. All you need is rest. How many times you did such tests to find out that everything is normal, all you need is, like a couple of days rest, you're all right, right? So such situations do happen, right? We do get stressed out, and that may, make your immunity go down, and that could have actually led you to some sort of situation which you think is an emergency situation, and you could have actually avoided by just being at home, if only there was continuous care and there was way for the doctor assigned to you had ability to monitor the data that you had, right? So this is a simple example to talk about how continuous care can provide multiple opportunities. And of course, the technologies that are enabling them, easy to wear and diagnose wearables, very, very important. I do remember how much effort medical devices company do put in training people to see how to put SpO2 monitors, ECG, and other things on the patient to ensure that they get right readings. It's very, very important that you get the readings accurately, right? But today technology has changed so much. You do have AI-based solution onto these equipments which actually compensates for such mistakes or highlights if such mistakes do happen then and there, right? There is a data which says that 35% of the ECG is typically repeated. 35% of the ECG that gets done gets repeated because one of the leads went wrong, right? If only there was a AI-based solution which highlighted there that, like I'm already getting some wrong data or this is not possible then and there, I could have actually corrected them there, right? Not many systems have such capability inbuilt into it. And again, one more challenge that we have here is many of the systems that are there in the field, they don't get upgraded very easily. That is where IoT provides a huge opportunity. I'll touch upon a little bit more how IoT can actually provide much more benefits in the healthcare system, especially when you consider this sort of scenario. And third one, which is important in continuous care, which is already there, is applications like chatbots, where we do have that. We do have that for identifying chronic conditions. For example, we do have chatbots, which is there for last 10 plus years, where you go to the site and give all your habits, habit patterns, conditions. It can actually say what is the probability of you getting cancer, right? So it is there. Now today, it is possible that like some amount of triaging can be actually done. There are enough applications we do have, of course, within Optum as well, which can actually triage the patient and say whether there will be deterioration in the next 24 hours or not, right? So there are quite a lot of applications that are possible, which actually can help identify whether an individual who is at home need to be admitted or can continue to be monitored at home or not, right? So those are the possibilities that are existing here. Now, the fundamental difference between what has been happening so far in remote monitoring versus what I'm urging you to consider now is wellness piece. The first two dimensions, where how can I take continuous monitoring to people who don't require any kind of, who don't have any sort of episodic intervention right now, but who are more aware that like they need to monitor them continuously to ensure that they don't end up episodic any point in time. That's the major shift that we need to focus upon, which is needs a lot of attention. And of course, the last one, there are two factors driving this. As I said, there is a huge misconception that we think that like hospital wants us to be at ICU for a long period of time. It is not true. It is not true at all. That is one area. Other area which you have to consider is geriatric population, geriatric care. In the next 10 years, the number of aging population in Africa and Asia is going to drastically grow, next 10 to 15 years. It's not far away. Drastically, it's going to grow. And these are the two continents in the world which also cannot afford healthcare today, as of today. So you have a myriad of problems that is coming here, which is a huge opportunity for us to make sure that we do right sort of intervention. And this is where continuous monitoring, proactive health check, as well as ability to provide care at home becomes extremely critical. It has been found that 40% of the incidents that happens can be actually treated at home. It is not just about reduction of cost, it is also about avoiding infection-related hazards, plus giving the comfort. There are many in this country can't afford to go to hospital just because they don't have support system. It is just that, if they take one day absence, it's not that they only lose their daily wage. The other person who needs to accompany the person will also lose the daily wage. It makes it extremely difficult. So continuous care and care at home has to reach to that strata as well. It is not just about the aging population, it is for also managing chronic condition at much better cost, so on and so forth. So with that, I would like to, quickly touch upon how this whole ecosystem is going to emerge. I just want to, draw your attention. So far, if you look at, we have been more focusing around EHR information, typical data that we have through medical records. The top off is where we were all focusing. And you'll be surprised to know that if I am really worried about value-based care or precision medicine, well-being of an individual, EHR and other medical records have only 8% of the needed information. The rest of the data that are needed to be able to provide better care is actually here. This is the tectonic shift that is happening, which needs your attention, my attention, everybody's attention. And of course, we are working very actively in this area. How do I ensure that all the data that I am able to collect is connected through the right network, and it is available to the right provider at the right time, and whether member gets to access the best doctor that is available across the globe for them. That is another area that needs focus. And of course, we also look at how the payer, which is the in US and other developed nations, which is typically the insurance provider. In countries like India, it is the government and you, right? So it is a nice model that is evolving for any payer. If people don't get hospitalized, it's a benefit to them, right? So there is a huge motivation. I tell my team, our goal is to ensure that nobody gets hospitalized. What a wonderful goal. I can proudly tell my team, our goal is to ensure that nobody gets hospitalized. So that's exactly what we are looking at. And I would urge you to look at the major shifts that are happening and see which part of the area that you are working upon and see how we can contribute. Thank you. Open for questions.
Thank you, Dr. We can take one? Okay. Thank you, Dr. Rajasekar, for a truly insightful session. Are you okay if we allow some questions, or rather just one question? Right, thank you. Is there any question from, okay, there it is. Can we have the mic, please? There.
Okay. Thank you so much for the insights. So in the last slide where you had shown that how the data flows between the different systems, especially for healthcare, the data has been lying in so many pools. Even if you're talking about EHRs don't talk to each other, right? There is no standardization of data. In fact, I was a part of a HIMSS work group creating certain standards, but still for the last 4 years, HIMSS has been trying for bringing in some normalization, and still the EHRs are not talking to each other, right? And we are talking about the Western world. India, EHRs, we don't even know how the data sets are sitting there. Secondly, the ownership of the data is actually, the ownership of that data is with the patient, right? It's patient's data. But once we get admitted to, let's say, a hospital, it's a struggle even to get the details out for our own data, let alone, let's say, a payer or someone else getting the data. So unless and until there is something which marries all of this particular data, the meaningful insights would always remain a challenge.
Yep, completely agree with you. However, things are changing, right? But it is changing at a very slower pace. Definitely, if you look at clinical data, there is a lot of standardization that is happening now. The HL7 adaptation is big, and now, of course, FHIR standard is coming up. So it is changing. You know, I won't be pessimistic on that front, but it is changing slowly, right? And the biggest driver of change in healthcare is going to be the government, unfortunately, right? That's what it is, right? And in US, for example, even in US, right, 10 years before, there wasn't much motivation for people to get onto the electronic health record at all, right? Till the act came that, you know, like, unless you have this data electronically, I won't be, you know, like, providing you the money, or insurance providers were, you know, like, told that you can't, you know, like, pay if it is not recorded. The same situation will come here. In fact, I am very optimistic that with some of the initiatives that are happening in India, we may actually leapfrog many other developed nations, right? Actually, it is not true that, you know, like, patients have the data. Unfortunately, today, do you carry your X-rays, a digital form of X-rays with you? No. But all these things are changing, right? Some of the initiatives that our government is doing, actually with the unique healthcare ID that you're going to have, combined with the DigiLocker and other things that are coming out, I'm very, very, you know, bullish about what can actually happen. I can walk into any hospital and provide, you know, like, a particular QR code at that moment, and all my history should be there. So that is exactly what, you know, we are working upon. And of course, it is not something which government alone can do. That is where players like you and I should, you know, like, be able to help big time. So I'm very bullish. It will change. We may actually leapfrog and may show, you know, rest of the world how it can be done more efficiently.
Thank you very much, sir. Great question, by the way.
Thank you.
May I now, can I just retain you for 30 more seconds? May I now invite Mr. Ajay Vishnu, founder JetBrain Robotics. Round of applause, please, to felicitate Dr. Rajasekar. Thank you, Mr. Vishnu. Thank you, Dr. Rajasekar.